Over the past few days, though, she's noticed the onset of jaundice, increased flatulence, light-colored stools, nausea, vomiting, and dark urine. She's also developed a recent onset of weight loss and irritability. Laboratory studies demonstrate an elevated white blood count, so it sounds like there's an itis in town. She's got a prolonged prodromatine. So that means prolonged prodromatine means either a decreased concentration or impaired activity of the coagulation factors. Serum chemistries and urinalysis is still pending, but the ER doctor's preliminary diagnosis is acute cholecystitis associated with biliary obstruction by gallstones. Okay. Although serum chemistries are still pending, what abnormality in her serum chemistries would be anticipated based upon her clinical presentation? Well, it sounds like she's got perhaps a gallstone lodged within her common bile duct, and it's resulting in jaundice. So the most obvious clinical abnormality is going to be elevated bilirubin level. And if you want to be more specific, which would have been great, it would be conjugated or direct bilirubin. Because the pathway for bile is being obstructed, and as pressure builds up behind the obstruction, then bilious fluid extravasates out of the duct and into the extracellular fluid, including the bloodstream. So that was the best answer. I got some other answers, but that was the best. Now, some people said hypokalemia. Well, the truth is that gastric juice, she's been vomiting, and gastric juice is very, very rich in potassium. So if you're vomiting a lot, you can get hypokalemia. I think maybe that same person put hypocalcemia. I'm not sure how hypocalcemia would fit in, but certainly hypokalemia good. Why is her urine darker than normal? Well, there's two answers. Her urine's going to be concentrated because she's been vomiting. She's probably volume depleted. The best answer, though, is that she's got bilirubinuria. That conjugated bilirubin is water-soluble. It's filtered freely at the kidneys, and it will appear in the urine. It will make the urine dark. Explain the cause for a prolonged PT and easy bruisability. Well, because she doesn't have bile reaching the small intestine, she can't emulsify fat, which is necessary for fat absorption. If you can't absorb fat, then you can't absorb vitamin K because it's fat soluble. So then you can't produce those vitamin K dependent factors. 2, 7, 9, and 10. That's going to prolong your prodromatine. That's going to cause easy bruisability. Why does she have light-colored stools? Well, if bilirubin present within the bile isn't reaching the small intestine, it can't be converted to stercobilin by bacteria within the gut. Stercobilin is what gives stool its dark color. So hence she has light-colored stools. The patient's white blood count is elevated because she's got an itis. She's got an acute cholecystitis. And so you would expect an elevation in neutrophils with a left shift.
So why is it acute even though it says that it's been intermittent for 6 weeks?
Well, she's had some gallstones. You know, most of the time when we have gallstones, eventually we pass those stones.
Mm-hmm.
But now what's happening is she's got complete obstruction and her gallbladder is becoming inflamed and she's becoming jaundiced and more symptomatic. So it sounds like one of those stones isn't passing. It's gotten lodged over the past week or so.
So is it, would it always be acute? I mean, would they be able to withstand the pain for?
Sometimes you can have chronic cholecystitis.
Okay.
But generally, if the major symptoms, and other than, if it's just stones, you're just going to write up a quadrant pain intermittently. Okay. But it seems like her major symptoms have come on over the past week, and that's the diagnosis that the ER doctors provided. So we're going by that.
Okay.
Why does Popeye's fried chicken elicit right up a quadrant pain? Well, when she eats anything that's fried, she's releasing cholecystitis. and her gallbladder is inflamed. Remember what inflammation means? It's tender. And so every time she eats something fat, the cholecystokinin is triggering that tender gallbladder to contract, and that contributes to pain. But also when you trigger a wave of contraction over the stone, as that wave of contraction, that peristalsis reaches the stone, that exacerbates the pain. It's like grabbing onto something. These stones are not necessarily smooth margin, that they often have little pointy things sticking out. And so as you grab that stone, it kind of creates more pain as well. And so the cholecystokinin is involved in that process. It's causing the inflamed gallbladder to contract, and then it's triggering that wave of peristalsis. Everybody get it? All right, pick up the test. All right, so today we're going to start talking about the kids.